A warm welcome to Empowering Forum. I am Imelda Isin. This is a continuation of our last edition on maternal health. Many problems among pregnant women can be preventable and treatable through visit with trained health workers before childbirth. One of the keys of reducing maternal mortality is to provide skilled attendance at delivery and access to hospital. That is why we're having an interview with Dr. Ameena Ali. Dr. Ameena Ali, she is a naturopathic doctor specializing in obstetrics and gynecology. She has been in organic medicine, home birthing, maternal education of women in the last 29 years. She is the founder and lead advocate at Federation of International Gender and Human Rights. At this point, we would like to take a break and play a short clip at the graduation ceremony organized by Federation of International Gender and Human Rights.
As we do at the beginning, and we are going to welcome you to the very first, and I mean very first, I'm not even scared to say it, the very first graduation of the Federation of International Gender and Human Rights. We are celebrating over 40 men and women that have decided to come forward to do this right now. The last 12 weeks have been amazing, amazing, amazing. We have made it thus far, and we have made it to this point to be able to gather brilliant minds all over the world to begin to give you a piece of their wisdom. To all the graduates, I want to say I thank you, I commend you, and I bring you forward to this moment right now that you have earned. And prayerfully, you will receive wisdom from the speakers that will be coming forth to you today. They are powerful women in their own right. We have elders, we have stateswomen, we have congresswomen, we have chaplains and those that have set themselves apart in their regality. And we have women that are coming together right now to tell you the power of the woman and the power of the female voice that is amongst us.
Women constitute over 50% of our population, yet they continue to be the most vulnerable in our communities. With a population of over 2 million people, more than 500 women die every year in childbirth, during childbirth, especially from the rural Gambia due to poor health care facilities. These, amongst others, have led me to establish a fund meant to support women to venture into a business to be able to support themselves and their families to sustain their lives and have a livelihood.
The spirit of service will require you to do two things. Number one, love with patience and compassion. If you cannot love with patience and compassion, you have failed already. If you cannot love with patience and compassion, you are in the wrong vocation. If you cannot love with patience and compassion, you don't know what it means to be human. If you cannot love with patience and compassion, then you need to ask yourself, why did you start on this journey? Number two, it's going to require you to do something that most of us don't want to do. We don't like doing it as humans, and that is checking your ego at the door.
I was a broken vessel for a long time. You see, when I was 16 years old, I was raped with a scissor. And at 16, you can only imagine being raped and violated with a scissor. And that is a story that I have kept in my heart for years, and it has been hidden. And as I struggle to overcome issues with self-esteem, issues with understanding who I am, today I'm free to share that story because everything in my life, the dots have been connected because I was a member of the Muted Voices. Back in the time when I was growing up, nobody would talk about being violated. In fact, if you shared with someone that you were violated, you would be ashamed and kind of ostracized from family and friends. Don't stay safe and comfortable. Say that right now. Don't stay safe and comfortable because you will miss out on being used by God.
Okay, so how can women enroll on this
Okay.
council session?
Simple. They go to the website, and the website is FIGHR.org. And that's the official website. And one of the tabs has the Academy on there. And what you do is you click on the tab, you go into contact us, you send me a message with your full name, again, given name, middle name, surname, in that order. And you give me where you're coming from, what country either you're coming from or what country you're representing. And then you give me a working WhatsApp number, and I will reach out to you and send you the application. Once you enroll and you do your essay and you do your letters and you get all of your information on what schooling you went to, your resume, all of that into me, then I will send you a confirmation of acceptance that says that you're enrolled in the school, and then you go through the course. Now the course is 5 weeks long. And once you are done, you get an international, if you're in another country, or a national, which is a domestic U.S. Certification. And whatever country you're in, you're able to do it in that country. If you need to go to another country, like if you're in Zimbabwe and you need to go to Nigeria, then you have to get a reciprocity, which means that it's a certificate that says you're able to practice now in Nigeria. And you get to charge money, and you get to charge your standard price for care. You could be for the whole village. You could be for the one woman. You can set yourself up to be the doula for the community. So it's very, very lucrative. It's very, very, very easy to get into. And what it is you have to have the desire to help.
Yeah. How long is the council session? How long would it last?
You mean it's 5 weeks? Is that what you mean? The education?
Yes. 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 How long would it last? 5 weeks, right?
It takes 5 weeks to become a doula, but it is a national registry and international registry that you renew every year. So what does that mean? Every year you're going to come back on the anniversary that you became a doula, and you're going to recertify, which means there's going to be classes that you have to take, and recertification, refresher courses, all of that. And you have to take 3 within that year in order to recertify. And once you take those 3 classes, I send you your new card. And your new card is to say you can practice for another year. Okay. Now, after you've done 5 years, you recertify every 2 years. Because now that you've been doing it for a while, we tend to think that you've gotten more experience. So every 2 years you recertify. After you reach 10 years, you recertify every 5 years. So it's a great way to get education and experience. And it's also a great way to continue your program. I've only had a handful of people that are been at the 10-year mark because they started at the beginning. But it's good to know that now that at 10 years, they really don't have to do too much education. They have to regain their experience. So they renew every 5 years. So now they don't have to renew for another 5 or 6 years, because depending on where they are in the program, because they've been doing it for 10 years now, and they're pretty apt, pretty sufficient.
Okay, so how many support groups do you have, and what are the requirements to create one?
Well, it depends on what you're doing. If you're dealing with doula work, there is a doula support group. If you're dealing with gender-based violence and intimate partner violence, there is a support group. That also includes female genital mutilation and sexual and human trafficking. But if you're doing the Federation Fellowship, which is on maternal care policy, then there's a group for that. But if you want to start a support group on Facebook or Instagram or wherever you do your grouping, just understand that whatever you do is more than what was there. So it's not like, oh, well, she's doing a group, and she's doing a group, and she's doing a group. Everyone can do something different, yet affect change. So Imelda's group can be dealing with FGM.
Okay.
Amina's group can be dealing with gender-based violence.
Okay.
So just because we're all
so you just
doing
need to
something
choose
different,
a particular area you want to specialize on.
Thank you.
That's
correct.
That's great. So how has been the response of manhood to fatherhood? When I saw that, I kind of laughed a little bit. I would like you to explain more. How is a program designed to educate, inform, empower absentee parents and new teen parents on the role, rights, and responsibility of being a man, then a father?
That's right. So many of us are born to traditionalists. I am one. I was born here in New York. However, my parents were very traditional. They still held on to a lot of the old country stuff. And they just assumed that when you were ready to marry, you knew what you were doing. And one of the things that I noticed is that a lot of fathers never knew how to support their women because they were never taught how to. So the Manhood to Fatherhood program is designed to teach them that you're not going to be this little kid playing video games or this little kid playing outside or this. No, you're a man now. And you have to take on responsibilities to include to take care of your child. And a lot of men didn't know how to do that because they assumed that's what the women did. No, the women need help. One of the reasons why they're stressed out is because they don't have help. You're standing right there in the house, but you're not helping. So what we do is we train the dads in what mothers need the most. What type of help can you muster? Can you change a diaper while she feeds the other baby? Can you bathe the baby while she puts the other baby to sleep? These are things that we help the father to understand how important it is and when to jump in and help. You shouldn't have to wait until the wife asks you to help if you're right there in the house. If you know it's about time for bed, get up and say, you know what can I help you with? Okay, why don't you change her diaper, put her clothes on, and I'm going to breastfeed her. And we do that so that, and then you rotate. Now, once I finish, then you bathe her, and then you put her in the bed, and then eventually we'll have all three of the babies in the bed in about an hour. But it's an hour versus 4 hours because she has help. So the Manhood to Fatherhood program allows men to understand that they have a role in not only creating the babies, but taking care of the babies. And their role has to come forward. We got to get out of this traditional thing of, I'm just standing here, I'm just a man, I'm just going to watch you suffer and just not do anything.
And start doing it, right?
Exactly.
Very correct. Okay,
That's
so
right.
So men can actually enroll on this session, Adam?
Yes, only men. Only men can enroll in this session.
Okay. How has milk bank donation and wet nurse consortium affected the program in the face of COVID-19? And is there an alternative means to help women who need breast milk to feed their babies?
That's right. Now, that is a great, great, great question. And I was hoping that you would say that in that way. Okay, the milk bank is just what it is. Your baby's 2 years old and it's time to get off the breast and you're like, thank God, but you still have milk. So what you do is you use the pump and you express the milk and you put them in the little satchels and you put them in the freezer. And the little milk bag, it looks like little plastic bags and there's Ziploc at the top. So you pump the milk into the bag, you put it in the freezer. Now, here's why that's important. If you are compatible, and this is where we test the milk and we make sure that the milk is healthy, it's okay, it doesn't have any, like you're not smoking, you're not drinking, you're not doing any drugs or anything like that. And once we test the purity of the milk, mothers that are either sick or mothers that may have, like, for example, we had a mother, I think it was in April, she ended up having to have a tooth worked on. Well, of course, if you're working on a tooth, you're giving her anesthesia. So the milk that she had during the surgery was no good because it had the anesthesia in it. And if she gave it to baby would automatically go to sleep. And we don't want anesthesia in the baby. So what I would do is I would call Imelda. Imelda, look, how many bags do you have? Well, I got about 5 or 6 bags. Okay. So I will come get the bags because I've already tested it. So I know her milk is good. And I'll come get the 5 bags from Imelda. And I will bring it over to the mother that had surgery. So now she can express her milk, dump it out because it has the anesthesia in it. We tell her to drink a gallon of water to clean her system. And then at the end of the day, or maybe the next day, she can begin to nurse again. But in the meantime, the baby needs milk. So we use Imelda's milk to supplement the mother's milk until her anesthesia is out of her breast. And we've been doing this for at least 9 to 10 years successfully. We've never had a baby reject milk. We never had a baby refuse the milk. We've always had a surplus of milk to the point where some mothers were like, look, I'll take whatever you have left. Like, I need that much. Some mothers are going in for surgery. Some mothers are coming out of surgery and they need to get that out of their system. Some mothers can't produce milk. What about mothers that have had breast cancer and they don't have breast anymore? They can't breastfeed. But they can use breast milk, which is what baby needs. It's not necessarily from the breast, but it's the contents of the breast. So if we can get breast milk in baby, breast milk is best. So we use the milk bank to allow other women to support other women. And this is a great thing because now that mother, in certain religious traditions, that mother is now the co-mother of that baby. So now that baby has two mothers, one that birthed the mother and one that
And the
fed
one
the
that
mother.
supplies the breast milk.
That's it. So it's almost like it's almost like you're sharing the job of raising this baby. And that's where the baby benefits, because that's what they say. It takes a village to raise a child, because we need that support. And one of the things we do is promote that support through the milk bank and allowing women to help other women, especially in their time of need.
How long will the milk stay in the milk bank?
Okay.
How long can it stay?
If I get it from you right now, I can freeze it for 6 months. I can deep freeze it for 1 year.
Wow.
But that's why we write the name and the number, the woman's name and the date on the bag before we put it in the freezer, so we know. But we have a 6 month and 1 year. If you deep freeze it, which is where you drop it down to almost zero, and that's like almost like a solid freeze, versus your freezer, which is probably like 25, 30 degrees. So it's frozen, but it's not frozen solid. When we drop it down to zero, we can keep it for a full year. And that's in the case of emergency. Remember, we just talked about having an emergency. So suppose the mother is stressed out, or she's, she just lost her home, or she's taken from, or she's been raped or something. And the mother just I can't mentally produce milk, because if she's stressed out, she won't produce the milk. The baby still needs to eat. So in those cases, we'll go to the deep freezer and we'll get one of those vials of milk and we'll give it to the baby while the mother relaxes and comes back into her own. But in the meantime, baby has something to eat. So baby doesn't lose, and mommy has time to get herself together to relatch. We call it a relatch, where we bring mommy back to baby and allow baby to nurse. And sometimes that even helps mommy to remember her purpose. And that helps her mentally as well. So it's a system to this.
It's a great one. You're doing a great job.
Thank you.
We have some messages here. Okay, Nonso Chuku is actually appreciating you for the great work you've been doing. And then Jennifer Uguche sent a question. She's saying, how can pregnant women protect themselves during COVID-19? Very
good. Okay, well, there are a few things. Before you get pregnant, stay healthy. Take your prenatal vitamins. Make sure you get enough fruits and vegetables. Stay away from people that smoke and drink and do things that will affect you. Then make sure that your household is healthy. Wipe down your counter spaces. Make sure your children are healthy. Give them a vitamin C. Make sure your husband stays healthy, and tell him to stay away from people that may be contagious. Then once you get pregnant, you are to stay healthy. Your only concern during pregnancy, especially if you're not working, is to stay healthy. So that means if you're going outside to do your exercises and get your hour walk in, make sure you wear your mask, make sure you wash your hands, and make sure you stay in an open area away from people. So you're not walking in the city. You go out to the country and walk, so that it is quiet, it is away, you don't have to worry about anything. And then do your walk and then go right back home. When you get in the house, take your mask off at the door. We always say this when we train. Don't wear your mask. You know how you come in the house and you just automatically start doing things, and then as you're doing stuff, you take off your mask. No, because whatever germs that were on the outside, you have now brought them in the house. So you take them off. I always say keep a little plastic bag or garbage can right at the door. Take off your mask, throw it away right there. Then by the end of the day, tie that up and throw that away. Why? We don't want those particles going into the air of your house and getting everyone sick. This is how it's called transference. This is how we bring the outside into our house. I know in my house, we don't wear shoes in our house because we don't want to step on something outside and bring it into the house.
You bring it
and then we pray in our house. Right. So we don't wear shoes in the house. So the same thing, we take off our mask, we take off our shoes, we throw the mask away. If it's a reusable mask, we make sure we have 2 or 3 of them, because what we do is take off the mask, we wear it for 2 days straight, we wash it. We don't want to keep wearing the same mask over and over and over and over and over again, because what we're doing is we're continuously bringing that germ into the house. So just like we wash down the surfaces, we got to wash our mask. So many people forget about that. So these are little tricks of the trade while you're pregnant. And then we have to make sure that once she has baby, that mommy and baby stay inside. 40 days is the rule. From the day baby is born, that's day 1. 39 days later, you have to stay inside. So that's a month and 10 days. And we say that because even in medicine, we say stay home 6 weeks, same thing. 6 weeks is the optimum time. Baby has enough time. It takes 30 days to get the milk into baby, to get its immune system. And if mommy is staying away, baby is staying away from everyone, stay in the bedroom and, you know, get your TV, get your snacks, get your food, whatever it is, but stay away from family, stay away from anybody that is coming in and out of the house, and don't allow any visitors. We say for 90 days or 3 months. So now that we have the technology, we don't need to have people coming into our house. We can pick the baby up and say, see, here's the new baby. Here's the new baby right here on Zoom. You know, so we don't have to have visitors come into our house and see our baby anymore. We can pick the baby up and show the baby to everybody right there and not have to worry about germs being transferred.
The baby needs to stay safe.
That's exactly right.
Okay, so we have greetings from Ben Yero. Ben Yero is sending you greetings, and Achibong is also sending greetings and prayers, and then Anika Nudoso is also sending greetings to you. Everyone is appreciating your good work. So that will take me to my, should I say, last question for the day. I noticed that you're offering a certificate program on reproductive educational series training that will take you on a journey from pre-menses to post-menopause. What is the process of participation?
This is the same. It is the same. You go to the website, you go in there, you let me know, I'll send you the information. However, the program itself is allowing you to understand your reproductive system. Remember, I told you when they get to a certain age, we teach them about their body. This is that program. So what we do is we go into the middle school, which starts at 7th grade, and we go all the way up to high school, and we train the women. We teach them what's happening in their body. Why are they having their period? What is going on with my body? Why do I have these boobs now? What is this hormonal thing? Why do I want to cry sometimes? Why is there this influx of energy that is happening to me? So we teach them about their bodies. Now, once they get over like my age, and it's 50 something, we get to the point where our bodies start slowing down and we no longer have our periods anymore. And we no longer have that childbearing ability anymore. What is happening now? So we have to reteach the body, because now this is something new. You know, the thing that we prided in doing and having and all this, now it's gone. Like, wow, it's gone now. I no longer have that ability. So now we have the emotional piece. We have the mental health piece. We have the feeling of less than, because now we don't feel like a full woman anymore. And then we're getting gray hair and all of the changes that are happening to us at this age. So now I have to sit down with women my age and say, look, this is going to happen and this is why it happens. So we train them, we retrain them. If they've taken our program when they were younger, we don't have anybody yet. But if we have someone that took it from like 7th grade, they actually can tell and teach, because they understand the body, they know what's happening, and they know what they're going through. But for those that are still coming into this, they have questions. And we're here to answer those questions about why our body's changing. Again, now that we're getting old and getting gray, and why does our hair start turning gray? What's happening in our body that makes our hair turn gray? And then why is it happening at 50? I thought you get gray when you're like 70 or 80. Why is it happening when you're 50? And then what's happening to our skin and our body and our and what it is that's happening to us at that age. And a lot of us want to know.
Yes.
So we give that education.
Most maternal deaths are preventable with timely management by skilled health professional working in a supportive environment. So ending maternal death should be a top priority for everyone globally, and it should be our agenda. So we need to work collectively to give these women the support that they need to reduce the number of deaths. That is why we brought this program to your doorstep. So I want to appreciate Dr. Ameena Ali for the wonderful job you've done today for educating us and enlightening us on this process. So I want to appreciate you for being part of this program in Perum Forum. Looking forward to have you more on our program for more sessions. Yes. So if we have more questions, don't hesitate when I call upon you to come up and attend to it.
Yes.
All right. Thank you very much, ma'am. So we are going to close our program for the day. I am Imelda Essien. The same time on Imperium Forum. Follow us on Imperium Forum on our page so you can get all our live notification and then join all our programs. You can also follow me on Facebook, Imelda Essien. So you can also follow me on YouTube, Imelda Essien, and then Instagram, Imelda E6. Thank you very much for this time. Thank you so much. Have a wonderful day.
You too. Bye-bye.
Bye, ma'am.